Hello everyone, welcome to BrainMindia. Today we are going to discuss about sensory neural hearing loss. Nowadays it is very common and lots of people are suffering from this neurological disease. It's a neurological disease, and today we are going to discuss about sensory neural hearing loss. And for that purpose, we have in our studio a famous doctor, Dr. Jakir Hossain Laskar. Welcome to our studio, doctor.
Thank you.
My first question will be, what is sensory neural hearing loss?
Yes, commonly known sensory neural hearing loss, but it is called sensory neural deafness. This sensory neural hearing loss occurs because of neural pathway of the cochlea. Neural pathway of the inner ear is disturbed. When this disturbance occurs in neural pathway, then people experience suffering like problem in balance and hearing loss, progressive hearing loss, along with tinnitus, along with severe sounds. This is called sensory neural hearing loss.
Okay. So, please tell us about the symptoms of this disease. What are the symptoms? How can we understand?
Yes, what are the symptoms? How will you understand that this is a case of sensory neural hearing loss? Actually, sounds become muffled and sounds become less clear when people are suffering in sensory neural deafness. Sometimes they may feel affected due to higher frequencies problem, and some people are having noise in noisy environments. Patients feel worse because of extreme sound. And these buzzing sounds which occurs in sensory neural deafness occurs either in a single ear or it may occur in both the ears.
Okay.
These are common. Dizziness are also the common symptom in this kind of deafness.
Okay.
These are main symptoms, yes.
And next question will be obviously, what are the causes of this disease?
Yes, causes. Due to aging, as the age progresses, people, both male and female, suffers in sensory neural deafness. But sometimes prolonged exposure to sharp noise can damage the cells of the hearing mechanism, which triggers sensory neural deafness. Some people experience hearing loss because of genetic predisposition. If the predecessors of any patient had suffered earlier in this disease, the successors of that family's members, some of them may suffer in sensory neural deafness. There are some ototoxic medications which triggers this disease. And normally some causes are there which are called some kind of infections. Various types of viral infections are evident to trigger sensory neural deafness. Besides, you can say measles, mumps, and brain disease, meningitis, which also triggers sensory neural deafness.
Okay.
Some new research revealed that because of head trauma, because of severe head injury, the structures of the eye are severely changed, which is why people also experience sensory neural deafness. Until recently, a disease has been in the fore. People have been suffering in this disease. This is called Meniere's disease. These patients experience balance loss and hearing loss simultaneously, which triggers, in the long run, sensory neural deafness.
Okay.
One more important point is in the brain there is a special kind of tumor which is called acoustic neuroma, which damages the auditory nerve of the brain, which eventually causes sensory neural deafness.
Okay, so before going to the treatment part, I want to ask you that how can we diagnose the disease?
Yes, diagnosis is important because to confirm the diagnosis, we expect from the patients that they have to undergo some procedures. One is audiometry. One is as the tympanic membrane of the ear is involved, so tympanometry also. And as the inner ear, I mean cochlea is involved, so cochleogram is important. So audiometry, tympanometry, cochleogram is required for the confirmation of the diagnosis. When in spite of having these three test procedures, diagnosis is not confirmed, we insist patients to go MRI. Medical MRI is required for the final diagnosis.
Okay.
No blood test is required in this case.
Okay. If after confirming the disease, how can we manage the disease? Is there any way to manage the
yes.
hearing loss?
Yes. Without medicine, there are some scopes. Actually, commercially, some hearing aids are available in all the markets around the globe, and those are very effective. Those are pocket friendly. People can purchase those hearing aids, and which is efficacious for having sound clarity, and it can solve the balance issue as well. Besides, nowadays some cochlear implants are available in the market. So these are not medicines. So these electronic devices, gadgets can help improve the conditions of the patients who have been suffering in sensorineural deafness. Some assistive listening devices are there. Speech reading and lip reading techniques may be followed under the guidance of speech therapist. That may also help. Some sign language may be practiced by patients having severe sensorineural deafness. Auditory training sometimes is indicated for the patients, those who are having for the long time in this condition, and some environmental modifications like background noise reduction process, some visual cues if they learn from the experts and they can use, then they can have conversations with other people with full clarity.
So is there any treatment in homeopathy?
Yes, certainly. I can say that more than 100 patients I have already prescribed, and most of the cases have been well managed. Okay, so people come from various walks of life, and as you can understand that hearing is an important item in our life. So they express a deep concern that how it can be solved without no one wants to use hearing aids. So they expect some treatment, and homeopathy has great scope in treating sensorineural deafness. For the guidance of practitioners in homeopathy having confidence in neurology, I can say some medicine suggestions for them. Cocculus indica is a great medicine, the one potency of which medicine is very efficacious in sensorineural deafness. The single dose twice a week, if it is taken for 3 months, patient's condition is improved by 50%. Besides, there is a constitutional great medicine. The name is Conia maculatum, 10 potency of which medicine is very efficacious in this regard as well. Sometimes to manage the acute condition, we prescribe a biochemic salt, calimuriaticum. Calimuriaticum, 12x potency. It has to be taken 5 tablets thrice a day for 1 or 2 months. If combinedly these 3 medicines are taken, mild and moderate kind of sensorineural hearing loss are managed well properly.
Well, that's all about the treatment of sensorineural hearing loss. But before ending the video, I would request all of you, please share this video as much as you can, and please do not take self-medication. Always consult a doctor before taking any kind of medicine. Well, that's all for now. See you in the next discussion.